Hello and welcome back for part 3 of our Leadership and Survival webinar series. At the end of March and beginning of April, we hosted 2 webinars to help you navigate both people and business leadership challenges that lay ahead. Over 2 months down the line, we're back and we're going to hopefully support you with what Patrick referred to the climb out. While many of you may have led through turnaround situations in the past, I suspect that few will disagree that we're all leading through uncharted territory, and the pandemic is adding another layer of complexity and concern for many of us as we plan our climb out. My name is Gemma Soul and I'm a director at School for CEOs. And to help you steer through the challenges that lie ahead are School for CEOs co-founders David Soul and Patrick McDonald.
Thanks, Joe.
David is a managing partner of the School for CEOs and has coached many of our top business leaders through tough times, including the 2008 financial crash and also the dot-com crash in 2001. And today he's supported by Patrick McDonald, our chairman, who himself has led through several business turnarounds and currently is also chairman of 2 private equity-backed businesses, Money, Penny and CCS. Hi, David. Hi, Patrick.
Thanks, Gemma.
Hi, Gemma. Great to be here.
Today's presentation is going to be filled with data, insights, watch outs and advice on how to lead out of lockdown. So thank you for joining us, and I'd now like to hand you over to David for the presentation.
Thanks very much, Gemma. Well, good afternoon, everyone, and welcome to this webinar. As Gemma said, this is the 3rd in our series, Leadership and Survival, and we're going to focus on the easing of lockdown and how we look after our colleagues as we do so and make the return to work. Albeit we're returning to a world that looks nothing like the one we left some weeks ago. Once again, in pulling together the content for this session, we asked for contributions from our faculty, some of the UK's best known chief executives, non-executive directors, and business leaders from a wide range of public, private, and family-owned organisations to help provide some further colour to our own thoughts. And we're indebted to them for being so generous with their time and also with their collective wisdom, which we'll share in due course. As Gemma said, I'd like to share some views and perspectives on the challenges as we emerge from lockdown for 35 minutes or so. In particular, the psychological challenges that we may still be encountering. I'd also like to look at what we can and have learned from the experience before touching on how we can return to work safely. Finally, we'll explore the potential legacies from lockdown, the positive ones at least, in the hope that we can adopt them before opening it up for questions and comments. So, as Gemma says, please do feel free to participate and ask lots of questions. But before we get going, I thought it'd be interesting to get your views on the issues that you found particularly challenging. So let's start with a quick poll. What have your greatest challenges been? Have they been personal challenges? Have you struggled to adapt to remote working? Has it been hard to see how your organisation is going to manage through this challenge, or has it not been too challenging? You've adapted pretty well and feeling quite good about things. Okay, that's interesting. A large proportion of people not finding it too challenging, and then we're a pretty even split between finding it difficult to work, adapt, thinking about how the business is going to cope, and very few of you struggling to cope with lockdown personally, which is encouraging. Patrick, you chair multiple businesses. What have you witnessed in these businesses during the lockdown period, and how have the people been coping there?
Yeah, David, I think the poll reflects the sort of responses that I've seen across the organisations I'm involved with. Thinking about the leaders in particular, some frankly have been loving it. They've loved the crisis. Some have tolerated it, and it's true that some people are hating it, although not so many. So I've seen the complete variety right there.
Thank you. In the very first of our webinar series, as long ago as the 31st of March, I mentioned the Persian king who asked his wise men to come up with a phrase that would make him happy when he was sad. That phrase was, "This too shall pass." Here we are, some 9 weeks further on, and there are signs that we might just be over the worst of it. Health services appear to have held up. The additional beds in the Nightingale hospitals have not been needed. Of course, there's been huge pressure on the NHS in the UK and key workers across this and other countries, and the death toll is horrendous. But it feels as though the crisis is coming to what may be an end, or what may be the start of a new beginning. So let's just recap for a moment. A pneumonia of unknown cause detected in Wuhan, China, was first reported to the WHO country office in China on the 31st of December 2019. The outbreak was declared a public health emergency of international concern on the 30th of January 2020. On the 11th of February, the WHO announced a name for the new coronavirus disease, COVID-19. And on the 11th of March, they declared the COVID-19 outbreak a global pandemic. Globally, as of 1 a.m. British summertime today, the 4th of June, there have been 6,366,788 confirmed cases of COVID-19, including 383,262 deaths. 216 countries, areas, or territories have reported cases, according to the World Health Organization. The world hasn't experienced anything like this since the Spanish flu pandemic of 1918. This particular outbreak was the deadliest in history. It infected an estimated 500 million people worldwide, about 1/3 of the planet's population at the time, and killed an estimated 20 to 50 million victims. The 1918 flu was first observed in Europe, the United States, and parts of Asia, before swiftly spreading around the world. At the time, there were no effective drugs or vaccines to treat the killer flu strain. Citizens were ordered to wear masks. Schools, theatres, and businesses were shut down. Does this sound at all familiar? In recent weeks, global stock markets have dropped between 15 and 25%. UK jobless claims soared by 70% in April, and unemployment has risen dramatically elsewhere as well, with more than 36 million people in the US filing for unemployment benefit in the first 2 months of lockdown. Oil prices have crashed, even turning negative at one point. Airlines across the globe are in crisis with a dramatic reduction in travel, and there is a serious risk of recession. The International Monetary Fund saying that the global economy will shrink by 3% this year. But there is some upside, as always. While governments around the world have urged employees to work from home where possible, shares in technology companies such as Zoom have shot up, as more people rely on video conference calls and email to hold meetings or get tasks done. There are other benefits as well. The European Space Agency has registered an impressive fall in pollution across European skies, with satellite images clearly showing how a strong reduction in emissions is now in place over major cities across Europe, in particular Paris, Milan, and Madrid. A similar trend has been detected across India's industrial hubs, where strict lockdown measures have been in place since March. There have been some positive consequences of being forced to remain at home for a prolonged period. Generally, people have adapted well to working virtually, although different demographics have acclimatized or not, depending on their circumstance. On average, many of the younger population, who are more familiar with and intuitive users of technology, have adapted well. They've been creative and flexible in maintaining social contact with their friends and relatives. At the other end of the age spectrum, the empty nesters have also coped with lockdown reasonably well, with no concerns about young or old dependents. But a recent World Economic Forum report noted that where parents were quarantined with children, the toll on their mental health grew steeper. Around 28% of this group of parents were diagnosed with trauma-related mental health disorder. The reasons cited for this were issues such as fear of infection or illness, losing loved ones, concerns about the health of elderly dependents, or financial stress. In the mid-1990s, the French developed a very specific response for terrorist attacks or natural disasters. Not only did they develop robust medical triage for those who'd been physically impacted by the situation, but alongside that, they put in place a psychological unit. The role of this latter team was to check those people who'd not been physically harmed during the course of the incident for post-traumatic treatment, dealing with any mental trauma that they might have been impacted by. This approach has become part of the international playbook for disaster responses worldwide. But although we've built hospitals and prepared for the physical effects of the pandemic, we are not preparing well for the psychological support required. Taking action now can mitigate against some of these toxic effects of lockdown. A survey of the Belgian population taken just before and just after they went into lockdown revealed how resilience dropped and the risk of toxic stress increased. Those reporting that they were highly resilient fell by 7 percentage points, while those at the high risk of toxic stress rose by 9 percentage points over the equivalent 2-week period. The researchers anticipated that these figures would worsen the longer lockdown went on. The symptoms of that psychological stress and disorder we've talked about before: low mood state, lack of sleep or insomnia, feeling stressed, anxious, irritable or angry, or simply feeling emotionally exhausted or depressed are all things to watch out for. This is particularly relevant if you know that you're in a group which is more at risk than others, which the World Economic Forum report identified as healthcare workers, the under 30s, children and the elderly, and those with mental illness, disability, or experiencing poverty. There can be no doubt that with around 2.6 billion people in lockdown, or 1/3 of the world's population, there will be some serious psychological issues to deal with. And that same World Economic Forum report suggested that there could be a secondary epidemic of a different nature in the second half of 2020, an epidemic of burnout or stress-related absenteeism. We know that absenteeism is a key issue. There are more cases of military personnel going absent without leave when their military units return from high-risk combat zones compared to normal circumstances. Following on from the 9/11 terrorist attacks in New York in 2001, companies that had offices close to ground zero, but who suffered no loss of life, noticed that many employees took leaves of absence following the disaster. And the medical professions experienced the same phenomenon in the aftermath of the SARS and Ebola outbreaks. Doctors and nurses returning from the at-risk geographies went absent from work on a regular basis. Leaders and organizations need to take action now rather than allow this ticking time bomb to go off. It's not too late to act. So how are our faculty approaching the issue? You can see the themes that are highlighted in bold text on the slide. Unsurprisingly, the focus on colleague well-being is top of their list of priorities, as it should be for all leaders of teams and organizations. Patrick, what have you noticed about how leaders are tackling this in the organizations that you work with?
Well, David, I've actually been very impressed by the response and by the leadership shown by the people that I'm working with anyway. I think they've done an absolutely fantastic job looking after their people, even as they completely reconfigure their businesses, both in terms of a dramatic loss in revenue in some cases and a move to home working in other cases. And the leadership teams have achieved miracles in some cases in making that work. Of course, it's now a more complex situation as we begin to climb out, and there's a whole host of different issues for leaders to balance. As I say, I've been very impressed so far.
That's encouraging to hear. So if we have a problem and we know we need to act now, what should we do? Well, there are a number of different ways to approach this. Colleagues can help themselves. Having an awareness of the issues and risks is key. So being alive to the symptoms of stress is important, because only then can you act. And there are many self-help activities to suit each individual circumstance, and I'll touch on some of these in a moment. Secondly, if there isn't an awareness of the issue, then education is key. Not only in the context of understanding and recognizing the issue, but also in normalizing it and being okay with that. No one will be immune to feeling down periodically or having anxiety about their own health or the health of their loved ones or colleagues, and that will impact their mood state. But accepting that this is part of life and that, again, this too shall pass is really important. For example, it's okay to feel sad if your pet dies. Recognize that this is natural, but also don't allow yourself to languish in self-pity or a state of permanent sadness. It's not healthy to remain in this state forever. Feeling depressed periodically is okay, and it's not the same as depression. You need to try and make a positive choice to move on in your mood state. And organizations have an obligation to provide resources to address the psychological issues of their colleagues. And if those mental health challenges are significant, which we can anticipate that some of them will be, there is a need and obligation to provide access to support for these more acute issues. As we said earlier, acting now and being prepared for this is critical in being able to address the problems when they do arise. I mentioned earlier that I'd touch on some of the things that we can do to help ourselves. Public Health England created a list of 14 different activities to consider, and I'm sure that many of you have incorporated some of these into your daily routines. But as we emerge from lockdown, it would be easy to allow them to lapse, and that wouldn't be helpful. Connecting with others is important, and we're all become very familiar with Zoom, Skype, or Microsoft Teams being a key enabler of this. Helping and supporting others. The theme of the recent Mental Health Awareness Week was kindness. And if you are worried about things, don't bottle up what you're concerned about. Talk about it. Try and make exercise routine to look after your physical well-being and look after your sleep. Reduce blue screen usage before bedtime, for example. And if you do get difficult feelings, try and normalize them, whether they're stress, sadness, or feelings of anxiety. We talked on a previous webinar about going on a media diet, so manage your media intake. But if you are using the media, focus on facts. Go to reliable, trustworthy sources. Try and do useful and meaningful things when you adapt your daily routines, and make sure you do things that you enjoy. Take pleasure from the activities. Some of you might enjoy setting goals, learning something new to give yourself control and a sense of purpose, and keep your mind active. Don't allow your mind to stagnate by binging on box sets or Netflix, but do take time to relax. Working from home, you need to make sure that you differentiate between what are work days and what are rest days or weekends. And try and get some fresh air, get outside, or if you can't, if you don't have access to that, make sure you open your windows to allow fresh air in. On our very first webinar in the series, we talked about the neuroscience that underpins resilience. In particular, we outlined that how we think impacts our brain's neurochemistry and causes the secretion of different hormones, which have a consequential impact on how we feel. Then, of course, how we feel impacts our behavioral responses. Remembering that we have a choice about how we think is key. We can choose to frame situations in different ways. If you remember the film Forrest Gump, when Tom Hanks is on his extraordinary run across America, he's approached by a guy who runs a bumper sticker business, who's trying to think up a great new slogan for his stickers. As Gump is running along, the guy runs alongside him, but then suddenly exclaims, "Whoa, you just ran through a big pile of dog shit." Gump replies somewhat philosophically, "It happens." The sticker guy says, "What? Shit?" "Sometimes," replies Hanks. Bizarre as this might seem, it's a classic case of reframing. One person's disaster is another person's day-to-day experience. You can think about and respond to the same event in different ways, depending on how you consider that event. The way you frame that experience in your mind will determine how you feel and subsequently how you behave. Clearly, we can all learn from Forrest Gump. So moving on to learning as a theme, let's have another poll. What have people learnt the most about in lockdown? Have you learnt about how to lead remotely? How to adapt your ways of working? Is it about adapting your business model or accelerating innovation? Or how to become more resilient? Okay, so it's been about adapting our ways of working and leading remotely as the probably 2/3 of people. And then slightly lower responses from the others. Great. Thank you. There has been no leadership playbook in this crisis. It's been a new experience for everyone. So both leaders and colleagues alike have had to adapt to working in a new environment where remote working and social distancing have been mandated. Leading a distributed workforce with no physical contact or ability to connect has been extremely challenging. So there should be some great insights for leaders. The first question has to revolve around, what have you learned about your own leadership and the talent in your organization? How have you and they adapted to the virtual world? How have you remained connected? How well have you communicated with colleagues, peers, and customers or clients? Who's shone in this particular crisis? When you reflect on your talented succession processes, have those who feature on those stood out? Or have they been eclipsed by others who are perhaps less well known? What has the emergency told you about your colleagues, good and the less good? And how have your teams performed? Have they stepped up and collaborated and cooperated more to get things done? Or have they retrenched, preferring instead to focus on their functional tasks, hoping that the COVID-19 storm will blow over and they can emerge relatively unscathed? One thing that leaders will need to be cognizant of is burnout, both of themselves and also of those who've gone above and beyond in their organizations. As normality returns, so the pace and intensity of activity should subside a little too. At the very least, leaders should take a breather from the intensity of the previous 3 months. And while organizations have had to adapt to new ways of working, there are also a number of learnings here too for future reference. How many of you have tried to run a Zoom or Microsoft Teams meeting with 15 or 20 people attending? It isn't easy by any stretch of the imagination and must reinforce the theories that the optimum team size is between 5 and 9 people. Something to consider for both teams and meetings as we return to the new normal. There is considerable evidence to indicate that team collaboration has improved dramatically under lockdown, and not only collaboration within an organization. The government of South Korea launched a data platform that reduced COVID-19 contact tracing time from 24 hours in early February to 10 minutes by the 26th of March. To manage this dramatic change, the system consolidates data from 27 public and private organizations, reinforcing the impact of great collaboration. As I mentioned earlier, times like these are new to everyone. There is no playbook. So people have become even more empowered than ever. And this has been reflected in a democratization of decision-making. McKinsey estimated that pre-crisis, 80% of decisions were made by 50% of people in organizations. This has had a massive uplift since lockdown, which has truly accelerated the pace and success of change. And of course, underpinning all of this, technology has been a driving force. No longer is technology seen as a support function in organizations. There can be no doubt that those who move faster sooner are the ones that will succeed in the long term. Pace and urgency has driven organizational change far faster than ever before. Bureaucracy and decision-making has disappeared, but not at the cost of good governance and controls. As we said earlier, the digital agenda is a fundamental driver for organizations and at the heart of their strategies, rather than simply being an enabler. And learning hasn't stopped. If anything, some organizations have seen it accelerate. One business, who had invested significantly in an online learning system pre-lockdown, had only had 7 people active on the system. By week 6, over 2,000 people had engaged with the system. Now, this is still just under 15% of the total business in terms of employees, but it is a significant step forward. And of course, not forgetting coaching, which has proved to be every bit as impactful and effective in the virtual world. So what new opportunities are you considering? Let's have another poll. Are you going to review your business strategy? Are you going to have a look at your digital strategy? Or are you going to think about the talent? Or are you going to review the ways of working?
Some comments came in on the last poll and also this one saying actually all 4. So I think maybe we missed out on an option there, David.
Yeah.
Apologies. I'm going to share the results for this now.
Okay, ways of working. Yeah, that's not surprising, I think, given that we're all working in a very agile way. But second to that, a third of people are saying going to review our business strategy. Interesting, only 6% on the talent strategy, which perhaps would say that you're comfortable with the way that you're reviewing talent at the moment. But perhaps we should have added all of the above again, Gemma. Patrick, what are you noticing about how businesses are looking to review what they're doing at the moment?
Yeah, very much all of the above, David. Of course, these options are not mutually exclusive, and some businesses are doing all of them. And I think that reflects the challenge now for leaders. It's, as I said, a more complex situation. You've got to move fast, but you've also got to take the right decisions. You've got to balance tactical issues like how to reopen the canteen and the amount of capacity to bring back, versus long-term issues like the shape of the new world and how you're going to adapt your business to that new world and which horses you're going to back, because you can't back all of them. If you get it right, it's a huge opportunity. If you can win in this new world, that's going to be an absolutely huge opportunity for people. But it's not easy to see what that new world is going to look like right now.
And I think prioritization will be a big issue as well.
Absolutely.
Okay, thank you. In the aftermath of the 2008 financial crisis, it became very clear that those who moved faster, sooner, did the best in the long term. The top 5th of organizations who were 20 percentage points ahead of their peer group pre-crisis in 2008 ended up 150 percentage points ahead of that same peer group some 8 years later in 2016. Agility and adaptation were key, as was the pace at which they adopted their changes. Before the COVID-19 crisis, McKinsey reported that during a recent survey, 92% of companies thought that their business models would change as a consequence of digitization. But 79% of those same companies were still in the very early stages of that change. It's not unreasonable to expect organizations to look at greater localization and resilience of their supply chains, to reconsider how customer and client needs will change in the new world, how to ensure costs and operations remain agile in a volatile, uncertain world, and most importantly, how they can attract, retain, and develop the talent needed to help them climb out. Clearly, digitization is an area of focus for many businesses, but there is still a need to be clear about where the value lies and what the route map to realizing that value is. Agility is undoubtedly critical in the new world, so the lessons learned from lockdown in creating pace and urgency to drive change are key. And to support any new strategy, it will be essential to have the right people with the right capability throughout the organization. The move to democratize decision-making and more empowered organizations will clearly be new for many businesses. So cultural change will be vital to ensure these organizations with shiny new digital strategies are successful. So, as we emerge from lockdown, how do we ensure that the return to work is safe? When I asked our faculty for advice on the emergence from lockdown, I was particularly struck by this comment from one of our chairmen, a man who had previously been a CEO in 2 businesses which he'd successfully sold. He said, if I were contemplating asking staff to return to work post-lockdown, I would simply adopt the same strategy that I would have adopted throughout the crisis. Namely, wrap them in a blanket of my time, my engagement, my reassurance, and my virtual availability, while as far as possible, making the decision of when or whether to return be theirs. It seemed both entirely logical, yet touched on some of the key issues that we've already spoken about, in particular, responding to the psychological impact of lockdown. Putting people first is essential as the return to work and offices increases. Communication on this subject remains vital, and if you fail, the consequences are stark. On Friday, the 15th of May, employees at Dyson, the innovative manufacturer of vacuum cleaners, received an email from the CEO of the organization, Roland Kruger, telling them that they had to return to work on Monday the 18th. The email was sent after hours and created an uproar amongst the Dyson employees. The very next day, on Saturday the 16th of May, the CEO sent a second email reversing the decision. It's not only the safety of the building that's important, but a recognition that colleagues have to travel to that building safely, enter the building and navigate the way to their desks, which of course will not be fully occupied with social distancing in place. Deloitte published a paper recently outlining 4 steps to think about in the return to work. Firstly, capacity planning, giving some consideration to the capacity of offices with the enforcement of social distancing, which will clearly be significantly lower. And of course, how do you get a phased use of public transport to get to the office? Demand management and well-being. Businesses should explore what are the critical roles in the organization that suffer from being done remotely. How can the organization ensure the well-being of colleagues? And does everyone really need to go to the office to be productive? Operations and safety, giving due consideration to building logistics. How do you manage lift cleanliness and other cleaning and hygiene regimes? Does temperature testing need to be instituted? And what happens if a building needs to be evacuated in an emergency? Can social distancing be maintained then? And finally, staff and visitor communications, ensuring that there are test and learn feedback mechanisms in place, but putting colleague safety at the top of the list. And as Dyson discovered, communication remains a key enabler of a safe and sensible return to the places of work. The UK government issued this advice regarding a return to work. For me, point number 1 seems the most sensible and straightforward, at least in the current environment. Work from home. Again, we've got some insights from our faculty, and some of the key points have once again been highlighted in bold. It's clear that the key priority is the safety and well-being of colleagues, and that has to be the overwhelming guiding principle in this instance. Patrick, anything you'd like to add to this?
Well, David, I'm seeing everything that you're talking about there. Leaders are very concerned to make sure that their people are safe. And of course, the people who are being kept safe are very concerned to make sure that they are safe. Indeed, I've seen some leaders beginning to burn out. You mentioned burnout. I'm beginning to see that a little bit as well. So I think it's incumbent on all of us to bear that in mind and to watch for signs and to work with that. And I think businesses, there's a need to play defense, which is a lot of what you're talking about here, get the basics right. There's also the need to play offense. It's still a business world out there. You've still got to go and beat your competitors. So you've got to find a way to play offense as well as defense at the same time.
Yeah, good point. Thank you. So what good has emerged from this rather bizarre lockdown experience? It's clear that organizations that have really focused on contributing to society in this crisis have truly enhanced their employer brand. Whether that's diverting manufacturing resource to support the crisis, keeping food and other necessities on their shelves, or supporting key workers, or making other contributions. Where businesses have contributed to helping during the crisis, there will undoubtedly be increased engagement within their workforce. And as the future unfolds, it will help them attract the brightest and best talent to work for them. The converse also applies, and sadly there are a few examples of these, where organizations haven't treated their employees well, or have focused on profit before people, there will be a consequential detrimental impact on their employer brand. Expect colleague engagement to drop, and worst of all, customers and clients seeking out more socially responsible alternatives. Having experienced over 2 months of a strict lockdown, it would be a great shame if we lost the good things that have happened over the course of this rather strange time. A few weeks ago, the Financial Times ran an article which outlined some of the legacies that would be good to maintain and preserve. Working from home is the most obvious change which could be made more permanent. 900 Texan women were asked a few years ago to rate their enjoyment of ordinary activities. At the top of the list was sex. At the bottom was commuting. There's a great opportunity to adapt and become more flexible with this. After all, businesses haven't ground to a halt in the last 2 months because you can't get to the office. And telemedicine, a simple yet effective change. Pre-lockdown, less than 1% of medical consultations took place via video link in the UK. It's now 100%. Using telemedicine for prescription refills and diagnostics will also help stop elderly, more vulnerable people killing time in surgery waiting rooms which could harbour infectious viruses. And we've all learnt to wash our hands better and take care of ourselves better. Use masks and self-isolating when ill. They're all good ways to improve hygiene. There's no reason to work through or tough it out in the office when you're not feeling at your best. And volunteering. At the start of the crisis, the UK government asked for 250,000 volunteers to help the NHS. They were 3 times oversubscribed, as 750,000 people offered to help. People have also volunteered by making PPE, gowns and masks. And communities have reached out to their elderly and isolated neighbours to check on their well-being. In Ireland, postal workers undertook this task, checking on the elderly and helping them with food and medicine supplies. While there's been an uptick in domestic violence during lockdown, so awareness of this issue has grown, and therefore it should demand greater attention in future. In France, support for victims of domestic violence was accelerated by offering them support through the pharmacy network. and housing the homeless. There are numerous examples of state, government or federal bodies diverting funds to house homeless people in unoccupied hotels or motels, which ultimately saves them money and obviously puts a roof over the homeless heads. And inclusion. Remote working has made work more accessible for those with disabilities, caring responsibilities, or looking after other dependents. The crisis has also, we believe, forced leaders to become more inclusive, to communicate more widely, to think more broadly and deeply about their colleagues' situations, and to adapt and change to accommodate the personal circumstances of their people. We said before that this is first and foremost a humanitarian crisis, so concern for colleagues is paramount. There are many learnings from lockdown. Let's not forget them or consign them to the past as we emerge, but embed them in our organisations. And let's not forget the positive legacies of this pandemic to benefit society at large in the long term.
Thank you. Thank you, David. Thank you, Patrick. And thank you, everyone, for joining us today and for staying on an extra 5 minutes. There are undoubtedly challenging times ahead, but we hope that today has helped to provide some guidance around how you might address some of those challenges. If you selected yes on the final poll, as David said, we'll be in touch with you over the next week or so to see how we might be able to support you. If you didn't select yes, but you might be interested to learn more about School for CEOs in future, then drop us an email on the email address on the screen right now, and we can talk through some of the ways we can help develop your senior leaders, both face-to-face and virtually. Finally, if you've enjoyed our webinars and would like to find other thought leadership material from the school, go to our website and visit the Thought Leadership page. There we share our podcast, which is a monthly podcast, our latest research, and also some opinion pieces. You can also follow our LinkedIn and Twitter pages where we share regular updates, and we'll be launching another webinar very soon, which keep a lookout for. It's going to be a really good one. Finally, thank you very much for joining us today. Good luck, and we hope to see you again soon.